Hi, I'm Dr. Renata Vix-Harris, and today I'm going to talk a little bit about doing a uplift where we use filler for the cheek and jawline. When we age, a lot of times we start to lose a little bit of volume in the mid-face, mainly around the cheek area, but also along the jawline. And you can use fillers to replace some of that volume loss and restore the way people used to look. In younger people, sometimes they just genetically have flatter cheeks or an underdeveloped jawline or chin, and you can use filler to augment that and make it look better. When we place the filler very precisely in specific areas, you can really help to lift and support the cheeks, augment the chin, and augment the jawline. We're adding support where you need it most, and people will notice that their cheeks look more lifted and more full and rounded. You will notice a more defined jawline. The goal is not to make the cheeks big. The goal is to provide support so they look lifted. So jowling is a typical sign of aging, and it can be difficult to correct without surgery. It really depends on how bad the jowling is and how heavy the tissue is, but you can definitely use filler to improve it and to kind of mask it by enhancing the jawline. So when we use fillers for younger patients, it's usually to contour their face and tweak how they look. When we do fillers for older patients, it's usually to restore the volume that they've lost and make them look more like they used to. So during the consultation, it's really important to find out from the patients if they're trying to make changes in how they look or if they're just trying to reverse their clock. The type of filler that you use depends on patient's skin quality, on their age, and on what their goals are and what you're trying to achieve. For example, if you're trying to enhance the cheeks, you want a stiffer filler that can provide lift and support. If you're trying to soften lines around the mouth, you usually use a thinner filler that blends more, so when you speak, you don't see it as lumps or irregularities. And so we usually use a combination of different fillers to get the best result for each patient. So this is a non-surgical way to reverse aging. It will not give you a facelift result, but you can definitely lift some parts of the face and improve the way you look. With this particular procedure, we place the filler usually pretty deep, and that doesn't tend to bruise or show as swelling, so most people can put on makeup and the next day it really doesn't look like anything significant was done. So results are immediate, although I usually find that it takes about 2 to 4 weeks for it really to kind of soften and blend and becomes the way it's going to be. It lasts on average somewhere around 1 to 1.5 years. It kind of depends on what kind of filler we use, how much of it we use, and how fast your body will break it down. So cost for this procedure depends on how much filler we need to use, but on average we start with about 3 syringes, which cost around $2,500. So one important point to remember is that facial rejuvenation is usually not a one-time event. And usually we like to combine different procedures with each other, and you don't have to do it all at once. You can do it in steps and just start somewhere and just kind of make a plan and then follow that to get the results you want to get. So one of the big concerns that a lot of patients have is that they're worried that it's painful or that it's not safe. In regards to safety, there have been millions of these type of procedures have been performed worldwide, and as long as they're injected properly, it's a very safe procedure. And here at Reflections, we know how to minimize the risk of fillers. So patients who have a lot of extra skin, and significant laxity of their skin, they're really not a good candidate for this procedure. They really need a facelift. But people who have volume loss, they notice some sagging in the lower face, they notice that their cheeks look a little bit flatter, those are usually good candidates. And if you want to know if you're a good candidate, I invite you to come to our office and get a free consultation so we can assess you and see what would be the best plan for you.